So I think in California, prior to the Public Health Infrastructure Grant funding, also known in California as the California Strengthening Public Health Initiative, most of our funding sources in California, both at the state and local level, have typically been considered categorical funding. And so often those funding sources will require the recipient to hire a certain position, write a certain plan, do a certain activity in their community. But those requirements were often prescribed by the state or the federal government, but not allowing the local level to really drive the priorities for their community. California Department of Public Health has been administering the Public Health Infrastructure Grant A2 funding to 50 of the 61 local health jurisdictions across the state. And many of those jurisdictions in California are really our small, rural, most underserved communities that are really needing core infrastructure to rebuild their public health systems. The Public Health Infrastructure Grant and the Future of Public Health Funds, which is the state initiative, work in a complementary way to support the growth of permanent personnel to develop and enhance and modernize technical infrastructure and systems, and to expand technical expertise and workforce capacity in areas that are most critical for serving the community, such as infectious disease, environmental health, community engagement and health education, and a variety of other technical advancements that help to support and sustain the public health infrastructure system for California ongoing. Small local jurisdictions who have never had an epidemiologist before, they are for the first time instituting analysis of critical data at the local level of community disease burden. It's critical to maintain those programs so that we are ready to respond and to support our communities, not if, but when the next infectious disease emergency occurs. We want to shore up our infrastructure, and we want to be able to build an infrastructure that is flexible and able to pivot to the emerging needs and priorities across the state and across the country, really.